Wonderful. So I just want to say hello again. I'm Jamie Seward, Associate Director of Lifelong Learning with the Office of Alumni Relations. Before we proceed, I'd love to acknowledge our co-sponsors, the Department of Neurology and Brain Sciences and the Healthcare Affinity. Now, I have the pleasure of turning the program over to our moderator, Rachel Ermer, Assistant Director of Development for the Department of Neurology and Brain Sciences.
Thank you, Jamie, and thank you to everyone for joining us today. I'm just going to jump right in and introduce our first presenter, Dr. Eric Kossoff. Dr. Kossoff is the director of the Pediatric Neurology Residency Program and a professor of neurology and pediatrics at the Johns Hopkins University School of Medicine. He focuses on the diagnosis and treatment of childhood seizures and epilepsy, particularly treatments other than medications, such as diet, neurostimulation, and surgery. He is one of the world experts on dietary treatment for epilepsy, specifically the ketogenic diet, and lectures around the world about this therapy. He is also a co-author of Treatment of Pediatric Neurologic Disorders and the 7th edition of Ketogenic Diet Therapies for Epilepsy and Other Conditions, along with Dr. Cervenka. Dr. Kossoff, thank you for joining us today, and I will hand it over to you.
Thank you all very much for the kind invitation to be here. I will, in 10 minutes, go through a whirlwind update on the use of ketogenic diet therapy for epilepsy in children. We're in an incredible time point in the use of the ketogenic diet for epilepsy. We are at the 100-year anniversary. In fact, we're actually at 101 because it was 1921, so 101 years ago, where the ketogenic diet was first proposed as a therapy for the treatment of epilepsy, both in children as well as adults. And that was 101 years ago. Here's a screenshot from the article in 1921 in the Mayo Clinic Bulletin. It was proposed by Dr. Russell Wilder, who was actually an endocrinologist, but had the theory that if you were on a ketogenic diet, a high-fat, low-carbohydrate diet, your body would go into ketosis, and that could be helpful for what they knew worked for epilepsy, which was fasting. And so his theory was that these were similar therapies, and if you did a ketogenic diet, it could mimic fasting and therefore help epilepsy. And so in 1921, when this came out, it was extremely popular, both in children and adults, but really kind of took off, in the next 10 to 20 years when we had very few other options for epilepsy, only to have a decline in the 1940s and 1950s. This screenshot is actually from Google Books, where you can search the term ketogenic diet in the medical literature, and you can see how it became very, very popular for about 20 to 25 years and then declined after that. 1993 was a really important turning point in the ketogenic diet. We had the Charlie Foundation formed to really raise awareness for the ketogenic diet, an incredible time point. As a result of this awareness from the Charlie Foundation, the ketogenic diet really took off in popularity. And you can see here, late 1990s, 2000s, the ketogenic diet has really exploded in popularity. And certainly for what I do in pediatrics and the use of the diet for pediatric epilepsy, it's really mainstream. This is 2018, our second revised guidelines endorsed by the Charlie Foundation, as well as Matthew's Friends, the Child Neurology Society, and the Carson Harris Foundation. We grouped together neurologists and dietitians from all over the world in terms of giving guidance for those of us using this for pediatric epilepsy in terms of how best to use the diet. And this really has led to a lot of research, a lot of further investigations into the diet. But I think it's a real testament to just how far the diet has come in pediatrics in the last 100 years to have such a document published. We now have multiple randomized controlled trials. So for a long time, the large criticism of the ketogenic diet, not just for pediatrics, but adults, was that there wasn't a lot of high quality evidence, and that has dramatically changed. As you can see here, there's 9 randomized controlled trials in pediatrics, all showing very good evidence for efficacy of the ketogenic diet. How does it work? Well, that's still something that we're looking into. And you'll hear about things beyond epilepsy in today's webinar, but even for epilepsy, where we've known that this is helpful for 100 years, we know that there's likely multiple mechanisms of action. We know that on a ketogenic diet, you will break down fatty acids through the liver into ketone bodies. And there are three. There's acetoacetate, beta hydroxybutyrate, as well as acetyl coenzyme A. And these are broken down through the liver, through carnitine pathways, and then they cross over the blood-brain barrier and are used for energy. But we know it's much more complicated than that. We know there's multiple mechanisms at work. This is a table and figure, from Dr. Rowe from 2013, which he is frequently updating as we learn more and more about the mechanisms of action, and more boxes keep ending up in this diagram. But we know that the diet does very important things to our mitochondria specifically, and seems to make it less likely to have continued epilepsy in patients who are on this therapy. But the exact mechanism of action is still under investigation. All of these different boxes are targets for different drug trials as well, to see if maybe we can mimic the ketogenic diet in perhaps using a liquid or tablet formulation. I'm going to show you guys a couple photographs of typical ketogenic diet foods created by parents and patients, and you can see very appetizing meals, appetizing snacks that are used all over the world for patients that are on ketogenic diets. Doesn't matter what country you're in, you can see here in various languages, different ketogenic diet foods that can be created. And it's actually, for the most part, not a very difficult, hard to tolerate diet for most of our patients. In the bottom right, you can see one of our new patients starting on the ketogenic diet there with some of the foods that she was given by the Hopkins cafeteria to be used in her ketogenic diet meal planning. In addition, there are many different ketogenic formulas now in 2022 available on the market in different flavors, different formulations, different actual components of what ketogenic diet nutritional compounds there are in there. Again, as you can see here in multiple different countries. And I think as well, there's really a movement to make the diet look much more like other foods that are on a perhaps standard or normal diet. And you can see here some photographs from a conference where you can see Quest was there with some different ketogenic snacks. There's actually Dr. Cervenka trying some. And you can see in the bottom left, a company in Italy that had some ketogenic diet pastas. And then amazingly enough, although I know my lecture is on pediatrics, you can actually, in fact, nowadays get zero carb beer. This was actually just available only about 3 weeks ago in local liquor stores. Pretty incredible what's changing in the field now. What's also, I think, great is that there's really a recognition that we can be much more flexible than we ever used to be. Traditionally, 100 years ago, this was pretty much the only way to start the classic ketogenic diet in infants or children. It was started in the hospital after a fasting period. Foods, as you can see here on the right, were provided by the hospital cafeteria every day, multiple classes teaching families how to weigh, measure, and calculate all the foods, with the dietitian intricately involved in calculating the ratio. And I think what's changed over the last 20 to 30 years, especially in pediatrics, is a recognition that there's different ways to do the diet and we can be more flexible. There's 4 now standard ketogenic diets. You can see the medium chain triglyceride diet, modified Atkins diet, and low glycemic index treatment in combination with the classic ketogenic diet. And even recently in England, a modified ketogenic diet, almost a 5th ketogenic diet, has been created. And they're all, for the most part, as you can see here by these pie graphs, high fat, low carbohydrate diets, but variants in how they're started and how they're maintained for patients that go on these different therapies. And I think this flexibility is really inherent in our consensus guideline, which, even though it's meant to give guidance to ketogenic diet centers using this for children, I think what's very clear if you read this document is that you can actually do it in various different ways, and that's okay. You don't have to fluid or calorie restrict. All the diets generally, in most studies comparing them, seem to be relatively equivalent, although we tend to use the classic ketogenic diet for young children and the modified Atkins diet or low glycemic index treatment for teenagers and adults. Most centers still admit, but you don't have to. Most centers do not fast, but you can if you want to. So again, a lot of flexibility. We know it works. We know that in about 50 to 55% of children who go on the ketogenic diet at 6 months, you will have a response greater than 50%, with about 15% becoming seizure-free. But we also know that there are some situations where children are more likely to become seizure-free. In fact, Table 1 of our consensus guideline lists those conditions where you have over a 70% response rate, or in the cases of some of these conditions here, one specifically, which you can see here, number 4, called epilepsy with myoclonic atonic seizures, or DOSA syndrome, you might have, in fact, a 90% response rate. Also, GLUT1 deficiency is about a 90% response rate. And so these indications, so to speak, are really known now to most pediatric neurologists, not even those using the diet, and they'll get these children to a ketogenic diet center sooner rather than later. We're very excited to think about using the diet in some of these indications sooner rather than later, and maybe even as a new onset therapy. We have a trial that's been going on now for about 3 years. That is a 3-month prospective open label trial at Johns Hopkins looking at children with new onset absence epilepsy, as would be often seen on this EEG here on the right, age 3 to 12. And families are offered either the modified Atkins diet or ethosuximide, and they can cross over if they wish. It's a open label, parent-driven study in this regard that's funded by the Carson Harris Foundation. We know there are side effects, and we're working really hard to ameliorate these side effects. We see these in all 4 diets and in all of the age ranges in pediatrics. Most of the common or even sporadic ones tend to be gastrointestinally related, but there are some rare and again, some sporadic side effects that we're working on, mostly with the use of supplementation. We think many of these supplements, if given with the ketogenic diet or modified Atkins diet for that matter, can really prevent these side effects before they even begin. We're really at an incredible crossroads now in the diet at its 101-year anniversary. We have recently created a society called INCS, the International Neurological Ketogenic Society, which has just been formed a few months ago in order to help guide the ketogenic diet research. Annual meetings like this one, which is coming up in 2023, in which many of the ketogenic diet professionals attend, share research, share ideas. And so INCS is brand new. The website, as you can see here below, is neuroketo.org. If you're interested, the website for the meeting is globalketo.com. And lastly, of course, thanks to many of my co-authors, who are one of which Dr. Cervenka is speaking here today. And this is a really, I think, great resource for families as well as caregivers, dietitians, and scientists interested in the ketogenic diet. And it's been a pleasure to be part of this book now in its 7th edition.
Thank you so much, Dr. Kossoff. So I will go ahead and introduce Dr. Mackenzie Cervenka. Dr. Cervenka is a professor of neurology at Johns Hopkins, the director of the Adult Epilepsy Diet Center, and the director of the Epilepsy Monitoring Unit. She focuses on the diagnosis and treatment of patients with seizures and epilepsy, including surgical treatment and diet therapies. She's an attending physician in the Epilepsy Monitoring Unit. Her specific interests include diet therapies for adults with epilepsy and status epilepticus, evaluations for seizure surgery, and epilepsy in women, including considerations during pregnancy. I will pass it over to you, Dr. Cervenka.
Excellent. Thank you so much, Rachel. And thank you everyone for joining us this afternoon. I will be talking about, can ketogenic diet therapy improve neurological diseases? So you heard all about ketogenic diet therapy for pediatric epilepsy. So I'm very excited to talk about other potential applications for ketogenic diet therapy as well. Here are my disclosures, and this is just to thank all of the sources of funding that I've had over time for these studies that I'll be presenting and others that you'll hear about today as well. First, I just wanted to show you a snapshot. And for those of you who may be patients with some neurologic conditions or have family members, clinicaltrials.gov is a wonderful resource where you can actually look up medical conditions and find out the clinical trials that are ongoing in the United States to be able to investigate these. And so this was a search that I did very recently, just typing in the term ketogenic, and these are recruiting and not yet recruiting studies. And on the left, you will see a whole list of different types of neurological conditions in which researchers are studying these conditions and trying to see if ketogenic diet therapies are appropriate. Now on the right, you can also see other conditions that are non-neurologic conditions, but may also be things that these patients with neurological disorders may have as well that could benefit from diet therapy. So you just heard Rachel mention status epilepticus. That is the first topic that I'd like to go over briefly today. Status epilepticus is abnormally prolonged seizures greater than 5 minutes with lack of recovery between seizures in a cluster. Now, either this is a single seizure lasting for 5 minutes or more, or back-to-back seizures where patients just do not recover back to their normal self in between seizures. And it is actually the second most common neurologic emergency worldwide, second only to stroke. It can lead, unfortunately, to death in up to half of people who do not respond to their traditional anti-seizure medications. And this is why this is so serious, and we need new treatment options for this condition. So we do have treatment options for this condition. You've already heard about epilepsy's big fat miracle, and you can always see as we're talking about consuming lots of fat, we like to show pictures of bacon, but not to worry for those in the audience that don't like bacon, it is not a requirement for being on the diet. It's just a very pretty way of talking about it. Now, why would we think about the diet being something effective for this condition of status epilepticus? Dr. Kossoff showed you these very complex interactions between the diet and different potential mechanisms of action for seizures and epilepsy. But one of the things that we think is particularly helpful for status epilepticus is that the diet therapies have been observed to actually improve inflammation. This has been done in a variety of different studies. There have been animal models of neurological conditions such as Parkinson's disease and multiple sclerosis, where inflammatory markers in the blood have actually decreased in these animals when they were treated with a ketogenic diet. Also, with animals that were treated with extreme temperatures to the skin, they've actually seen a reduction in pain and local inflammation. And then we also know that ketone bodies themselves, as you heard about from Dr. Kossoff, which are produced by consuming fat and metabolizing fat, can actually block inflammasomes in the cells that typically release these inflammatory biomarkers. So we really think we understand why this is happening. Here's a study that we did that was funded by some very generous philanthropic support. And this was a phase 1-2 multi-center ketogenic diet study for adult super refractory status epilepticus. And these are very, very severe patients that have status epilepticus that have to be treated actually with a medically induced coma in order to control their seizures. So they have a breathing tube and they have a feeding tube, and you can actually give them ketogenic diet through that feeding tube as a formula. We wanted to study 3 things. We studied feasibility, which is whether or not we can get patients into ketosis, into a state where they're producing ketone bodies. And fortunately, all of the patients in this study, we were able to do so. Safety, is this safe? And we found that it was as safe as the condition itself and as other patients that are treated with ketogenic diets. And then effectiveness, that was the major question, was would this diet work as a part of the treatment for super refractory or very severe status epilepticus? And in fact, 73% of enrolled participants in this study actually had a response and had resolution of their status epilepticus. Now, just to put this into perspective, this is actually in comparison to about 40% of patients in the general population using standard therapies that are not ketogenic diets. And this is just an example of a gentleman who fortunately woke up from his medically induced coma, and here's what he thought about his experience on the ketogenic diet. And he did very, very well and had no more seizures after this treatment. Now, moving on to another topic that's of major health concern is mild cognitive impairment and Alzheimer's disease. This is considered cognitive decline with memory loss, and mild cognitive impairment in particular is considered a transitional clinical phase between normal aging and dementia. The prevalence of Alzheimer's disease doubles every 5 years after age 65. So 10% of adults 65 and over have a diagnosis of Alzheimer's disease, and this increases to 33%, or a third of adults 85 and over. So this is a huge concern in the medical field and in the care of individuals that are elderly. With regards to ketogenic diet therapy and dementia, what we know about dementia is that there is a reduction in cerebral glucose metabolism. This impairs insulin and insulin-like growth factor expression, or we think of this also as type 3 diabetes. ketogenic diet therapies have actually been shown to reduce these amyloid plaques that actually can deposit in the brain, causing dementia. And ketone bodies have likewise been shown to correlate with improvement on Alzheimer's disease cognitive assessments. Now, here's a study that was done at Johns Hopkins in collaboration with the neuropsychology team. So Dr. Allison Buchholz, Dr. Jason Brandt, and also our Institute for Clinical and Translational Research dietitians, Diane Vistham and Bobby Henry Barron. And this was a study of older adults with mild cognitive impairment and Alzheimer's disease, looking at whether or not a ketogenic diet therapy could actually improve cognition over time. And so this is a preliminary report, and certainly further studies are warranted to look into this in more detail. This was a 12-week study that compared patients on a modified Atkins diet, which you heard about from Dr. Kossoff, versus a National Institute of Aging, or NIA, diet for 12 weeks. This was a study that was very complex with regards to recruitment, and they actually screened 752 participants before they were able to enroll 27. So this was a huge effort. And in the end, what they found was that patients that were on a modified Atkins diet who made urine ketones, so they were producing ketone bodies, had an increase in their memory composite score between baseline and 6 weeks, an increase. So they actually had improvement in their memory, while those on the NIA diet actually had a decline in memory over time. Now, these differences were not statistically significant because of the small number of patients, but certainly this actually gives us some evidence that this is something worth pursuing. And these patients on the modified Atkins diet reported an increase in energy levels, and so this was also very encouraging. And of course, every time there's a study, there is also a book. So there is a book, and there are many books actually out in Amazon, and you could see websites and things promoting the use of ketogenic diet therapies for the management of dementia. I just thought this was a pretty clever picture, so I wanted to show it. And then finally, this is the last topic that I'll be talking about today. And then you'll hear more from Dr. Tanya McDonald about adult epilepsy and Dr. Karisa Schreck about the role of ketogenic diet therapies in glioma, but I'll be mentioning episodic migraine. Why I picked this topic in particular is that this is such a huge disease burden overall in the world, and many of you actually on this call may even have episodic migraines yourselves, because 12% of adults in the US have migraine. 4 million have chronic migraine, and it's the third highest disease burden worldwide. Response rate to current therapies is only about 50%. And so why would we think a ketogenic diet might work for episodic migraine? Well, if we think back to that inflammation, we think back to reduction in pain, those might actually be applicable to migraine as well. And so this was a clinical trial of 18 patients with episodic migraine, and they were evaluated after they had been migraine-free for 3 days, and then treated with a modified Atkins diet. And they were also compared to 18 age-matched healthy control participants. For all of the patients with migraine, they measured attack frequency, duration, severity, and 2 different measures of responses to pain at baseline and at 4 weeks. And so what they found was actually the patients that used the diet therapy had a reduction in frequency of attacks, the duration, and the reduction in disability from headaches, and these were statistically significant. And before treatment, patients with migraine did not habituate to noxious stimulation compared to control patients. So in other words, their response to pain was abnormal even before, just in the state of having chronic migraine. And after treatment, what was found is that this response actually normalized on a ketogenic diet therapy as well. And so, of course, once again, there are many, many books that are out and available about migraine and ketogenic diet. And so certainly, I think this is also an emerging field that warrants further investigation. And so here is our Johns Hopkins Adult Epilepsy Diet Center. I want to just thank our coordinator, our nurse, our dietitians, and the physicians that I collaborate with in our center. And of course, I also want to thank our development office, our patients, those who participate in studies and also support our research. And I want to thank you all for joining us today as well. And I'm happy to take questions. Thank you.
Thank you so much, Dr. Cervenka. I think lots of people who have migraines will be checking out the ketogenic diet For now, we will introduce our next presenter, Dr. Tanya McDonald. Dr. Tanya J.W. McDonald is an assistant professor of neurology at Johns Hopkins. She focuses on the diagnosis and treatment of epilepsy and seizures. Her specific research interests include evaluations for seizure surgery and epilepsy in women, including considerations during pregnancy, and the impact of ketogenic diets like the modified Atkins diet on cardiovascular health measures in adults with epilepsy. So I will turn it over to you, Dr. McDonald.
Thank you so much for that introduction, Rachel. And thank you all for inviting me here today or this afternoon to talk about ketogenic diet therapies for adults with epilepsy. So to get started, here are my disclosures again, just showing some of my sources of funding over the years for some of the research that I've been doing. Okay, so to get started, for those who aren't familiar, epilepsy is one of the most common neurologic conditions worldwide, with an estimated prevalence of about 68 million people. The median prevalence is about 0.6% in developed countries and 1.5 to 1% in rural and urban developing countries. So studies have shown that roughly half of patients with epilepsy will become seizure-free with the first anti-seizure drug tried, and probably around 12% of patients who fail the first seizure drug will actually become seizure-free with the second anti-seizure drug tried. So roughly about 2/3 of patients are thought to be responsive to anti-seizure drugs. Unfortunately, roughly 1/3 of patients have less than a 5% chance of becoming seizure-free with successive anti-seizure drug trials, despite the development of over 25 different anti-seizure drugs over the last century. So for these drug-resistant epilepsy patients, non-pharmacologic approaches like the ketogenic diet offer needed adjunctive strategies to improve seizure control. So as you heard about from Dr. Kossoff, the ketogenic diet has actually been around for over a century now. And one of the earliest published reports of efficacy in adults happened in 1930 at Mayo Clinic in Rochester, Minnesota. They reported on 100 adolescents and adults who were treated with the ketogenic diet as monotherapy, and they found that 56% of patients derived benefit and 12% became seizure-free. So as Dr. Kossoff also mentioned, over time, there have been a number of modifications to the classic ketogenic diet to increase palatability and adherence to diet therapy. The classic ketogenic diet was shown here, and different fractions and ratios of carbohydrates to protein and fat were derived for the modified Atkins diet, which basically restricts carbs to 10 to 20 net carbs per day. The low glycemic index treatment, which basically aims to select carbs that have a glycemic index less than 50, and the medium chain triglyceride oil diet, which basically uses different percentages of medium chain triglycerides or MCT oil in combination with foods to produce and achieve ketosis. And as mentioned, we think of almost like the fifth ketogenic diet therapy, the modified ketogenic diet, which instead of aiming for a 3:1 to 4:1 ratio of fats to carbohydrates and protein combined, aims for a 1:1 to 2:1 ratio of fats to carbohydrates and protein combined. Today, the most commonly used ketogenic diet therapies in adults are the modified Atkins diet, with the classic ketogenic diet as a close second, and the modified ketogenic diet and the low glycemic index treatments are close runners-up. So you heard already about some of the efficacy rates of the ketogenic diet in the pediatric population. So just how effective are ketogenic diet therapies in adults? So this was the first study of the modified Atkins diet in the adult population done here at Johns Hopkins, where they looked at 30 adults treated with the modified Atkins diet over a 6-month period. They found that 47% of patients had greater than or equal to 50% seizure reduction at 1 and 3 months. And this greater than 50% seizure reduction is a pretty common benchmark for success in clinical trials, also known as a responder rate. At 6 months, 33% also had greater than 50% seizure reduction. Subsequent to that study, there was a 2014 review published in Neurology that looked at 10 observational studies of ketogenic diet therapies in adults, 5 with using the classic ketogenic diet and 5 using the modified Atkins diet. They found pretty modest efficacy. So there was a 32% responders of the classic ketogenic diet and 28% of responders for the modified Atkins diet. And again, these are the proportion of patients who achieve greater than or equal to 50% seizure reduction. The effect in most of these studies was usually rapid. You could start seeing a reduction in seizures in as little as a week. However, many patients discontinued therapy because of perceived diet restrictiveness, and only about 50 to 60% remained on diet therapy at study completion. There have actually been 2 meta-analyses published looking at the overall efficacy of ketogenic diet therapies in the adult population. The first, published in 2015, looked at 12 studies and found a combined responder rate of 52% for the classic ketogenic diet and 34% for the modified Atkins diet. And a more recent meta-analysis in 2018 incorporated a few additional studies, 16 in total, and showed a combined 53% responder rate for all diet types, meeting the definition of ketogenic diet therapy, and that 13% of patients achieved seizure freedom. So more than the 5% that can be expected with successive anti-seizure drug trials. There have actually now been 3 randomized controlled trials looking at ketogenic diet therapy in the adult population, and this is the gold standard for clinical evidence. Each of these studies actually use the modified Atkins diet, which is the most common diet type used in the adult population. The first was an Iranian study that randomized 66 adults with drug-resistant epilepsy to either continue anti-seizure drugs in their usual diet compared to the anti-seizure drugs that they were already on and initiation of modified Atkins diet therapy. The primary outcome in this study was a responder rate of greater than or equal to 50% seizure reduction. Roughly 2/3 of patients were able to complete the 2-month study, so about a third attrition rate, and 35% of patients in the diet arm achieved greater than or equal to 50% seizure reduction compared to no patients in the control arm. The second RCT was a Norwegian study that randomized 75 adults with drug-resistant focal epilepsy. So this is different from the Iranian study in that the Iran study included adults with both generalized and focal epilepsy, and this study specifically only accepted individuals with focal epilepsy. They randomized them to either their habitual diet in combination with their medications or their medications in combination with modified Atkins diet initiation. The primary outcome in this study was looking at change in seizure frequency from baseline. Roughly 3 out of 4 patients in the diet arm completed the 3-month study. They found no statistically significant difference between the diet and control groups in terms of seizure frequency after the intervention, their primary outcome. But in secondary outcomes, they did find that more patients in the diet group achieved a 25 to 50% reduction in seizures compared to controls. Now, the third randomized control trial was actually done here at the Johns Hopkins Adult Epilepsy Diet Center. It was a randomized crossover controlled trial of 80 adults with drug-resistant epilepsy randomized to either modified Atkins diet initiation alone or modified Atkins diet initiation in combination with the use of a ketogenic formula, KetoCal. The primary outcome was, again, the proportion of patients achieving greater than or equal to 50% seizure reduction. Roughly 7 out of 10 patients completed the study, and we found that 47.5% of patients in the treatment arm, that is the diet in combination with the supplement, were responders, compared to 37.5% in the control arm, those who were just on the diet alone. This was not statistically significant, but a large proportion of patients were considered responders in both arms. We did find that those patients who received the ketogenic supplement in combination with the diet were more likely to continue modified Atkins diet use even following study completion compared to the control arm, suggesting that the ketogenic formula supplement might be a method of trying to improve adherence and compliance with the diet more long-term. So collectively, these studies showed responder rates of up to 48% for the modified Atkins diet, with a range of 11% in the Norwegian study, up to 48% in the study here at the AEDC. Attrition rates range from 14 to 35%, and the most common adverse effects were gastrointestinal related, which is similar to what's been seen in some of the studies in kids. We did also note, though, there were some patients that experienced an increase in certain cholesterol markers, total cholesterol and LDL levels. And as I mentioned, patients supplementing the diet with the ketogenic formula were more likely to continue modified Atkins diet use. So most of these studies though were done over a time period of 3 months or less. And so in thinking about more long-term response, we've looked at how patients have responded at 6 months, 1 year, and even longer in an observational study done at the Johns Hopkins Adult Epilepsy Diet Center. And we find that patients who begin modified Atkins diet therapy, roughly 31% show a greater than or equal to 50% seizure reduction rate at 6 months, and 14% are seizure-free, and that these rates hold true at about a year, with 30% of patients showing greater than or equal to 50% seizure reduction and 13% seizure-free. So in an attempt to elucidate whether the response to ketogenic diet therapy is dependent on epilepsy type, whether it's more beneficial for generalized epilepsies or focal epilepsies, a 2020 review looked at then published 21 prospective and retrospective studies of ketogenic diet therapy in adults, and found that 48% of patients with generalized epilepsies responded to ketogenic diet therapies, compared to 34% of patients with focal epilepsies. That's a higher percentage of responders with generalized epilepsy, and that this was statistically significant, suggesting that the diet might be a little bit more beneficial for those with generalized epilepsies over focal epilepsies. So taken together, these studies suggest that the ideal adult candidate for ketogenic diet therapies include patients with specific epilepsy syndromes. As Dr. Kossoff had mentioned, glucose transporter protein 1 or GLUT1 deficiency syndrome, the diet is considered first-line therapy. Also considering Angelman syndrome or tuberous sclerosis complex. The diet would be an ideal consideration for patients with refractory generalized epilepsy, like those with juvenile myoclonic epilepsy or juvenile absence epilepsy. It's also useful in patients with drug-resistant focal epilepsies who are either not surgical candidates or who have previously failed surgical therapy. It's useful in patients who wish to limit potential side effects that they may have incurred with the trial of anti-seizure drugs. As Dr. Cervenka mentioned, it's particularly useful in new onset refractory status epilepticus and other super refractory status epilepticus. And we think it's particularly useful in patients who are either highly motivated or especially compliant, because again, adherence remains a particular challenge in the adult population. So like any medical therapy, the ketogenic diet does have potential side effects, several of which are listed here, and as mentioned earlier by Dr. Kossoff, but many of these are fixable or preventable with close medical supervision and care. And so like the pediatric population, there have been recommendations for monitoring both at baseline and follow-up that have been suggested for the adult population, many of which do mirror the guidelines for the pediatric population in terms of getting a baseline assessment of nutrition, food allergies, food availability, et cetera, and monitoring seizure frequency, weight changes, et cetera, over time. We also do suggest ketone monitoring in urine or blood early on in diet therapy, but do stress that diet adjustments should be focused on optimizing treatment response, minimizing side effects, and promoting sustainability of the diet, and not necessarily just fixated on that particular number. In addition, there are recommendations to try and achieve success with diet maintenance. And we found that frequent support from a ketogenic diet therapy team is crucial for fostering knowledge, skills, and confidence in adults managing their ketogenic diet therapy. We've also found that generally speaking, we recommend a minimum of 3 months to judge whether or not the ketogenic diet is efficacious before thinking about discontinuing therapy. And that generally speaking, the time frame for discontinuing ketogenic diet therapy is largely dependent on the underlying condition being treated and the response to treatment. And traditionally speaking, for epilepsy patients, we think about a 2-year period of seizure freedom before thinking about weaning off or tapering the diet. And so in conclusion, ketogenic diet therapies have been used safely and effectively for over a century to treat adults with epilepsy. However, as many medical therapies are, they should be used with medical and nutrition supervision to avoid adverse effects and optimize therapeutic benefit. These are my acknowledgements. Oh, I went too far. Yeah, these are my acknowledgements. Again, thanking my colleagues and patients who have been treated at the Adult Epilepsy Diet Center. And I want to thank you for your attention and open the floor, of course, for any questions.
Thank you so much, Dr. McDonald. We do have a few questions, and Dr. Kossoff has been kind enough to answer some of them for us. But I'm going to go to the questions that he mentioned he'd like to do live. So in addition to helping with epilepsy, headaches, etc., I wonder if the panelists could talk generally about the potential health benefits overall of being on the ketogenic diet. If any of our panelists, Dr. McDonald or anyone else, wants to take that question, that would be great.
So yeah, I know one of the potential side effects that we are particularly interested in are potential cardiac side effects. Do you mind if I share my screen again? So one area that I'm definitely interested in is the cardiovascular impact of diets like the modified Atkins diet on cardiovascular health. And so we've done, we have active ongoing investigations, but we've also completed a few studies looking at that important question, one of which looked at patients who were on the modified Atkins diet for a year or longer compared to diet naive controls, and looked at risk factors for future cardiovascular disease. So your standard lipid profile, looking at cholesterol levels, LDL cholesterol, triglycerides, HDL, and found that patients who were on the modified Atkins diet for over a year actually had lower triglyceride levels compared to diet naive controls. We did find, though, that there was an increase in small LDL particles in patients who are on the diet for a year or longer compared to controls. However, that this did not translate into increased thickening of the carotid artery, which we assessed by doing carotid artery ultrasounds over that same time period. This was a cross-sectional study, and so we then went on to look at a prospective study, which is still ongoing, and so we don't yet have the vascular results, which are done annually, so stay tuned for that. But we do have some early evidence suggesting that we do see similar trends in terms of increase of LDL particle number and small particles, medium particles, and some other risk factors early on when you first start the diet, but that these changes are adaptable and we no longer see them as you continue diet therapy at 6 months, and we'll be assessing if that's true at a year or two. And so certainly there are potential side effects to watch out for on the diet. We're actively investigating some of those, and we'll be thinking about different interventions that can be used to ameliorate any that are found.
Have you seen any health benefits?
Oh, yes, generally speaking, even beyond seizure control, many of our patients, as Dr. Cervenka had mentioned in one of the studies for Alzheimer's disease, they reported improved energy level. A number of patients also report improved concentration. Another study that we haven't talked about here because 10 minutes is such a short period of time was looking at patients who had improvements in their anxiety or depressive levels. Does the diet also have benefits from that standpoint? And so many patients have reported anecdotally, even outside of seizure control, other benefits. Many patients who come to the diet center thinking about the diet for seizure control also have the goal of weight loss. And of course, ketogenic diets have been used for almost over 50 years for weight loss and control from that standpoint. So there are a number of other potential health benefits that we've observed in our patient population.
Great. Are there any studies looking at the ketogenic diet and autoimmune neurological diseases such as CIDP?
A small study that we recently did with autoimmune epilepsy. So this was with one of my colleagues, Dr. Khalil Husari, where we looked specifically not just at what we were talking about earlier was status epilepticus, but patients with a history of autoimmune epilepsy. And actually they did particularly well on a ketogenic diet, probably because of the relationship with the inflammation that we talked about. I know that also multiple sclerosis is another area that is actively being investigated outside of the neurological conditions, rheumatoid arthritis. That's another very active area. I would have to look at CIDP in particular. I'm not sure that came up on my list when I was doing my clinicaltrials.gov search.
Great, thank you. Do seizures go back to the baseline level when the ketogenic diet is stopped?
I can tackle that. We have some experience over the years in pediatrics because generally in pediatrics, in most cases, we'll try to stop the diet after 2 years, different than on the adult side. And we know in most of those patients, about 80%, the seizures actually stay at the level they are on the diet after 2 years when the diet stopped, which is fascinating. They don't revert back to what their baseline was. 20% can, the seizures can worsen and you can go back on the diet for longer periods of time. But, and we don't know completely why this is the case. Does the diet, sort of do something for healing? Does it sort of help improve the underlying epilepsy in some of these children? Does it accelerate what we know in pediatrics sometimes happens where children, their seizures can get better over time, but it's not completely clear. But yeah, usually after 2 years, at least in pediatrics, we'll try to stop the diet. And most of the time they don't get worse again. It's a good question.
Great. Anti-epileptic drugs are often used as mood stabilizers for people with bipolar illness. Have there been any studies on the effect of ketogenic diet on bipolar illness that you know of?
So there are a couple of studies looking primarily at mood disorders and the effects of ketogenic diet. I know Dr. McDonald was saying in mood disorders in patients that have epilepsy because there are high comorbidities, but actually there are researchers who are investigating it independently for mood disorders like bipolar disorder and depression. I think a lot of those studies are ongoing as well.
Great, and I think we have time maybe for one more question before we move to our last presenter. Are there studies on the effects of ketogenic diets on prevention of constellation of Alzheimer's symptoms or manifestations once mild cognitive impairment has been diagnosed?
So I'm happy to address that. So in the study that I showed, that did include patients with both mild cognitive impairment and early Alzheimer's disease. There are other studies that are looking at the diet in later stages of Alzheimer's disease, but this particular study did also target patients who had mild cognitive impairment. There are certainly studies that are being designed to try and start to introduce the diet even earlier in the stage of mild cognitive impairment when patients are first showing signs. I'm not aware of any that are looking at prevention, because those would have to be very, very large studies in order to show that the diet actually prevented mild cognitive impairment or Alzheimer's disease when the patient is asymptomatic.
Great, thank you so much, Dr. Cervenka. Okay, we are going to move on to our final presenter today, Dr. Karisa Schreck. Dr. Schreck is Assistant Professor of Neurology and Oncology, is co-director of the Braff Brain Tumor Center at Johns Hopkins. Her research focuses on the development of targeted therapy for patients with primary brain tumors. This includes metabolically targeted therapies such as ketogenic diets and intermittent fasting, as well as the development of small molecule inhibitors. Dr. Schreck has specific expertise in the treatment of BRAF gene mutations. Dr. Schreck also writes and runs clinical trials using these targeted therapies in patients with primary brain tumors. I will pass it over to you, Dr. Schreck.
Thanks, Rachel. This has been a really interesting and lively discussion so far. And I'm going to change the subject just a little tiny bit to talk about one specific type of neurologic disease, and that is brain cancer. Before I start, I'm just going to share my disclosures here. This is some of the funding that we have for our research work. None of it is germane to our discussion today. And probably one of the most common questions I get when I see a new patient in clinic is, should I be following a specific diet? Is there anything I should do, supplement, diet, to help with my course of treatment to help fight this brain cancer? And so I just wanted to start off by saying, I'm going to be sharing some of the research that's being done in this area. That's very exciting. But as of this moment, there's no scientific proof that any specific herbal supplement, vitamin, micronutrients, or diet can cure brain cancer. And it's actually really important to discuss those with your main oncologist to let them know what supplements you're taking, because some of them can actually interfere with the treatments that we know can have an effect and help kill the cancer. So it's really important to talk about this stuff with your doctor. And I'm glad that you're here today to gain some knowledge as well. I think it will be helpful in informing that discussion. Also, probably the most important thing someone with cancer can do do in preparing for treatment and fighting their cancer is definitely making sure their nutrition is balanced and adequate. And that means getting enough calories from the different food groups, getting enough of those micronutrients and vitamins to help the body stay strong through a course of treatment and to help the immune system stay strong as well. And lastly, there's a lot on the internet out there, a lot of Facebook groups about diet therapy in general, ketogenic diet in particular, and then diet during cancer treatment. And I would just encourage all of you to take it with a grain of salt. What works well for one particular person or feels good or makes sense may not necessarily be the same for another person. That applies to many of the things that you'll see on the internet. And so today I'm going to focus very specifically on one type of diet intervention, that is the ketogenic diet, like you've been hearing about for other neurologic diseases. And keto is huge in the brain cancer community. Why is that the case? Well, that actually dates back many years, this idea of the Warburg effect, the idea that cancer cells thrive on simple sugar molecules that are easily digested, and that having high blood sugar levels feeds the tumor and allows it to be more metabolically active. And we know from tests done in a laboratory with cells in a petri dish that glioma cells, brain cancer cells, can use glucose, one of those simple sugars, about 3 times as fast as normal brain cells. So this is an attractive idea. We also know that if you take brain cancer cells out of a patient's brain during their surgery and grow them in the laboratory, that it seems that these cancer cells don't utilize ketone bodies as well as normal brain cells can. So it seems there may be a differential in sensitivity to treatment. Additionally, there's been research done looking at human tumor cells implanted into mice and looking at whether a ketogenic diet or fasting diets will prevent the growth of those tumors or cause the tumors to shrink actually. And the answer is yes. And it turns out if you combine a ketogenic diet with a form of intermittent fasting in mice or just a caloric restriction, that you see an enhanced effect. And so, to those of us who are in the business of treating patients on a daily basis, this preclinical data, right, these experiments done in cell culture and in mice were encouraging and attractive and forced us to take a closer look and say, well, could something like this be helpful to my patients who have glioma? And so there have been 4 or 5 different clinical trials. These are basically experiments in people to try to look at different forms of ketogenic diet interventions to see whether they would have a benefit. And the answers actually still aren't totally clear despite that. The reason for this is multifactorial. There's a lot of reasons. So most of these studies were small. They had very different types of diet interventions. So as you learned today, as Dr. Kossoff went over beautifully, there are multiple, probably 4 or 5 different dietary interventions that fall under the umbrella of a ketogenic diet. And many different ones have been used in patients with brain cancer. Additionally, as you've heard already from Dr. McDonald and Dr. Cervenka, these diets are a little complicated and they can be hard to follow for patients. And so many of these studies have had a lot of patients drop out and just say, this is too hard, I don't feel good, I can't finish this. The length of the intervention has been different and also the timing of the intervention. So patients with brain cancer go through chemotherapy and radiation, and some of the studies have looked during that, some have looked after. And so it can be a little bit confusing to understand what's going on, whether this is helpful and when it would be helpful. And so that is a question that we here in neurology, Dr. Cervenka, Dr. Kossoff, myself, and many others wanted to try to answer in a little bit more of a strict fashion. And so we opened the glioma Atkins-based diet study. And I would just say this is a study that was funded solely through philanthropy. So this was, patients, other physicians and families who believed in this type of research who made this study happen. And we are so, so grateful for their assistance. It wouldn't have happened without them. And so we designed the intervention to take advantage of both the modified Atkins diet, which you've heard about a lot so far, as well as 2 fasting days per week. And the reason we wanted to do that is because of this component. I told you that mice that were on caloric restriction saw an enhanced survival with their glioma as compared to mice who only were on the ketogenic diet. So we wanted to look at both. And so on the modified Atkins day, patients had a 20-gram carbohydrate restriction. The focus was high fat. The goal was to get their bodies to use ketones for energy. On fasting days, patients had a small caloric supplement, a keto cal drink, and then lots of hydration. And so the total intervention was 8 weeks, and this was in patients who had already received radiation and chemotherapy for their tumor. And so what did we see? Well, the key observations: out of 25 patients, 21 of them were able to complete the study, this 8-week intervention. All of them developed measurable ketones within a week, and 80% hit that threshold of moderate or greater, which is where we really think the ketone bodies are having an effect. And we did see an effect on people's bodies. We saw a small but significant change in serum glucose level, blood sugar levels over time, and in body fat as well. So we saw a decrease in both of those. Probably the most interesting thing that we saw actually, though, was a difference in the brain and in the brain tumor. And so we did a special type of MRI called MR spectroscopy. You see the little blue box and the little purple box here. In those little boxes, one in the area where the tumor was, that's the purple one, and one in normal brain on the opposite side, we looked at different proteins, including ketone bodies in the brain. And what we found was that we were able to detect ketone bodies. That's these squigglegrams down here, the one ACE and BHB. Those are 2 different types of ketone bodies. We didn't find them before the diet, but we did find them after. And this was true in the normal brain and in the brain tumor as well. So we see these ketone bodies are measurable there and possibly even accumulating there. We're still working to understand what exactly that means, but the diet was having an effect on the brain as well as the rest of the body. The other thing we learned from this study, like you've heard already, is that dietary interventions are tough, especially in adults. So about 80% of the patients, as I told you, were able to finish the study, stay compliant with the diet. If we looked at the patients who stayed compliant with our very strictest definition of never going above 40 grams of carbohydrates a day and always being in ketosis when they were fasting, though, it dropped to about 50%. So this was tough. And the patients who did it were really motivated and did a wonderful job. The take-home points I think that I'd want you to take away from today and think about as we think about ketogenic diet interventions in people with brain cancer. First, the patient experience is really important. When a patient doesn't have good support or finds the diet hard to follow, it's going to be tough to do. And someone who's undergone chemotherapy and radiation, in addition to the rest of life, this is very challenging. While we don't have proof that the ketogenic diet by itself can make people live longer when they have a glioma, we're still working on that part. We have studies left to do. We do have some evidence that it's making an impact in the brain and is accumulating in the brain cancer itself. And in thinking about next steps, we do think that certain kinds of brain cancers, specifically those with a specific mutation called IDH, might be more susceptible to the effects of ketogenic diet and fasting even. And then lastly, I saw a comment before asking about supplements. This is something that we are thinking about, seeing how hard it is for patients who have cancer and are on chemo and radiation to also follow this diet. We're investigating whether using ketone ester supplements could be helpful and could possibly serve as a substitute for strict diet adherence in certain situations, like during radiation. So stay tuned. Those are studies that are ongoing and that we're hoping to have results for in the near future. And I too, lastly, just want to close with acknowledgements. None of this would have been possible without the amazing research team that you've already heard from today, as well as the support through philanthropy that you see listed here, which has really been instrumental in allowing us to conduct and complete this study.
Thank you so much, Dr. Schreck. That was a very interesting presentation. And thank you so much to our presenters. And I will pass it over to Jamie. I know we're about at time to give us some closing remarks.
Well, that's it. You said it all. And everyone, this was so wonderful. As a sister, my sister has epilepsy, so I'm sure she's going to be really interested in seeing this recording. And I really appreciate all the research you're doing on a personal level. So thank you for doing this great work for all of us. Thank you for being doctors in this crazy environment. You are heroes and we appreciate you. So with that, thank you everyone for attending, and we look forward to seeing you at a future webinar. So thank you so much.